Heart failure, that's a very important thing and can come over with really different scenarios. So a patient who is coming to you who is having hypertension and telling you, doctor, I started getting breathless. Upon questioning, you ask the patient, tell you, doctor, specifically when I climb the stairs, or doctor, when I'm lying flat, I can't really lie flat without being breathless. So you need to ask these questions to the patient. Do you get any leg swellings? Oh, yes, doctor, I get ankle swellings. So be always aware about that. Whenever you're asking a patient about swelling in the leg, you need to ask about any ankle swelling, because swelling always starts in the ankle. Again, why I'm saying this information is basically because you can ask a patient, have you got any leg swelling? And the patient can tell you, doctor, I don't have any leg swelling. However, they have ankle swelling. Believe it or not, that can happen. So you need to ask whether this patient having ankle swelling, not leg swelling, ankle swelling. Okay, fine. So a patient's coming to you, so with like this sort of breathlessness, and coming to you, newly diagnosed heart failure can come with different scenarios. So imagine a patient coming to you with newly diagnosed heart failure, telling you, doctor, I'm having this sort of swelling in my leg. And also this patient actually is having diabetes, and this patient is on metformin. And coming to you, and you do think this patient has heart failure. From the scratch, what can you do? So first of all, you need to bring this patient for examination. You need to listen to his heart, you need to listen to his chest, you need to check his blood pressure, but also you need to do blood tests, and you need to do mainly the pro BNP. So we're going to do a simple blood test. So first of all, heart failure. How can you explain heart failure to the patient? That's a very important thing, because whenever a patient hears heart failure, they tend to get panicked. They tend to get worried. Heart failure is as if you're telling patients you have cancer. The word heart failure is a very, very scary word. How can you explain that to the patient in a layman language without making them feeling scared? Anybody can explain heart failure, please?
Yeah, Mr. William. Okay, now go ahead. Alicia, yeah, go ahead, please.
Sorry, yeah, that's fine. I think he dropped his hand. So yeah, Dr. Hashim, yes, please go for it.
Yeah, Mr. William. So based on the symptom you have described, so I'm just going directly. So your heart is struggling. When I say struggling, it is struggling to push blood, and then medically in our medical term we call this heart failure, but it does not mean that your heart has stopped working. It just means that it is struggling a little hard.
Perfect. Or you could say, so heart failure is a common long-term medical condition, or fairly common long-term medical condition that can present with similar symptoms like you mentioned to me, like breathlessness and also swelling in your ankles. So this condition actually meaning that your heart is not pumping blood as it should be. It might sound more scary than it actually is. The good news is this condition can be actually brought under control with medications.
It is
However, if left untreated, what's going to happen is, unfortunately, it can affect your heart negatively and the rest of your body, and also can cause fluid buildup in your lungs and make your breathlessness worse. Perfect. So that's why I'm asking about heart failure. How can you explain it? That's a very important way to explain it.
Yeah.
Perfect. So can you request an echo? For any patient who is breathless? No, you need to do a BNP first. You need to do a pro BNP first. Or like a BNP or NT-pro BNP. There's a minor difference between them both, but don't worry about that. Don't worry about the difference between them both. Okay. What else you need to do? If this comes back on the higher side, we can also arrange for a chest X-ray, we can arrange for an echo to assess the function of your heart. To assess the function of your heart, we can do an ECG, a heart tracing as well, to check how good your heart is in terms of functioning as well. Okay, so it's very important to know what's the level of BNP. What's the level of BNP? Because if it's above 2,000, so this patient needs to be seen urgently in 2 weeks' time. If this level is between 400 and 2,000, this patient needs to be seen in 6 weeks' time. Okay, that's a very important thing. Echocardiogram. Does it make any difference in treatment? Anybody knows?
Yeah.
Perfect. How can it make difference in treatment?
I guess systolic or diastolic function, so the treatment is entirely different.
Okay, so preserved ejection fraction or non-preserved ejection fraction?
Yeah.
Anybody knows what's the difference between preserved and unpreserved?
I think preserve is like over 50 or 45. Yeah.
50, yes, over 50. Okay, fine. And below 50 is unpreserved. Okay, so does it make any difference in treatment? Yes, it does. If it's preserved, then we can treat with water tablets, can treat with furosemide. Okay, that's a very important thing. If this patient, her echo actually comes back unpreserved, then the next step is going to be, we can have a discussion with the specialist, but also we can start her on the list of medications that I have listed here, like ACE inhibitors, beta blockers, and diuretics, but also mineralocorticoids, ivabradine and sacubitril. All of these can be specialist medications, but always you need to tell the patient if the echocardiogram came back suggestive that your heart is not, or severely not, pumping blood as it should be, then what we need to do is to start you on a list of medication. Okay, but meanwhile, what we could do is to relieve the symptoms of breathlessness. We can prescribe you a medication called water tablet or furosemide. Very important to warn the patient about the side effects of furosemide. It can make you go to the toilet more often and also can cause some salt imbalance. However, we will make sure that you're fine. We'll arrange regular follow-ups. We can also check your kidney functions in 2 weeks' time to make sure that you don't have any salt imbalance. Salt imbalance, very important, can cause salt imbalance. Again, any medication you're going to prescribe to the patient, you need to tell the patient, what is this medication going to do? How can it help? And then tell the side effects of this medication. But bear in mind, if a patient, I'm giving an example which is not related here, patient is coming to you today telling you, doctor, I have stomach ache, I have tummy pain. And then you decided that you think this patient has GORD or acid reflux, and you prescribe lansoprazole. So what's the common side effect of lansoprazole? I'm giving an example, just an example. What's the side effect? What's the common side effect of lansoprazole?
I mean, long term is low sodium.
Fine, but what's the most common side effects of lansoprazole that can happen actually even straight away? Tummy upset. Why I'm saying this? So you can imagine, patient is coming to you today because they're having tummy upset, and you're giving them a medication that causes tummy upset. You can't really sell that to the patient. The patient is not going to accept that. So bear in mind, you need to tell the patient what are the benefits of taking this medication, concentrate on the benefits of taking this medication, and then just, but it can also cause some issues like diarrhea and loose stool. But again, most people do well on it. I can't remember the last time I've seen any patient having any side effects of this medication. So this is how can you sell this medication to the patient. So imagine that you're telling the patient, oh, it has like hundreds and hundreds of side effects. This patient is not going to buy this medication from you. This patient is not going to get this medication from you. But if you tell, oh, that's a very good medication, it helped a lot of people getting through such situation, but at the same time, this medication can have some side effects, but again, most people do well in it, and I can't remember the last time I've seen anybody with side effects on this medication. Okay, so Q-risk score is very important in any patient whom you do things that they might have a probability of having heart attacks in the future. You can imagine that a patient who is having an MI or a heart attack, this MI can lead to heart failure. But again, a patient on heart or having heart failure, this patient can still get an MI as well. So we need to check this patient's cholesterol levels. We need to check this patient's cholesterol levels. Actually, we need to check this patient's diabetes levels. We need to check this patient's diabetes levels because diabetes, blood pressure can always be connected, and also high cholesterol levels. So never ever forget about actually any patient who's coming with suspected heart-related issue, you always need to do cholesterol levels. Very, very important. Very, very important. Don't get much worried about the medications that's been put here, but you need to be aware that if this patient echo came back as very severe or unpreserved, so this patient needs to be on a list of medication, but again, this patient will need to be seen by the specialist anyway. The reason why I mentioned a patient who's coming to you with heart failure and diabetes, why I'm saying this, a patient is on metformin, coming to you today, diabetes is on the higher side, and this patient is having heart failure. So what's the next step is going to be? If patient's HbA1c is 60, coming to you today, this patient, you think they have heart failure, and actually you did the investigations and came back as heart failure, and he's coming to you today with also uncontrolled diabetes. So what's the next medications that should be prescribed here? Anybody knows?
SGLT2.
Perfect. Let me sort this question in a different way. So if this patient is not diabetic, can you still prescribe dapagliflozin or empagliflozin? Yes. And he is having heart failure.
Yes.
Sorry? Yes, you can still do that. Okay, but that's further down. Yes, definitely. Thank you so much. You can still prescribe dapagliflozin because it can actually help protecting the heart itself. Bearing in mind, of course, you can also consider something like spironolactone. So spironolactone, dapagliflozin can be prescribed for patients solely for heart failure, and they don't have to be hypertensive or diabetic. But if the patient is diabetic, with uncontrolled diabetes, so also it's a very, very good thing if a patient is having heart failure to also say that you're going to start empagliflozin or dapagliflozin, because that can help protecting the heart as well as can also help with diabetes as well. Actually, that's the first line if a patient is diabetic and the patient is having any cardiovascular issues. Okay, I hope that's clear. So never forget about dapagliflozin in a patient who is having heart failure and also heart failure and diabetes. Okay, perfect. So let's move to the next one. Yes, of course, you're going to speak about lifestyle changes. Again, healthy diet, low salt, because salt can cause fluid retention in the body. So we need to discuss like low salt diet, weight management, smoking cessation as well. You can also refer into the heart failure team. So the heart failure team, we discussed when to refer the patient to heart failure team, both cardiologists, nurses, and also other healthcare providers to provide him with optimal care and optimal management. They can also do regular follow-ups. We spoke about psychological support as well with any patient who's having long-term medical condition.